Go ahead.
Hello everybody, my name is Hamideh. I'm an MD from Iran and MSc in e-health from McMaster University. So as I told you in my introduction, I work as an e-health analyst. So I work in human side of technology, helping IT technical team and clinical end users to communicate together, to know communicate through a very simple and jargon-free language to being a part of a team and work together for health technologies. So being that said, I know that you are all better than me in IT field. You know the back end of the health technology, what's going on there. But I'm not back end, I'm not IT professional. So I just walk you through the lens of a clinician to help you what's in front end of health technologies. So after that, you can find it interesting to join some startup teams and health, working on health technology groups or projects or anything. So it's just regarding these area. With this presentation, I aim to tell you about the definition of e-health or electronic health, its importance in healthcare, different types of e-health tools and its challenges. It's a kind of quite new technology, quite new area of knowledge. It's kind of 60 years old, sorry. It comes with different names: health technology, digital health, health or medical informatics, health information technology, or health IT. From all of these different names, I believe e-health is more general name because it's, as I'm telling you in the next slide, it's with a definition provided from WHO or World Health Organization, is the usage of information and communication technologies for health. You can see in the photo, there is a physician talking with another physician through a video call. So it's e-health that provides this tool for physicians. Talking about health IT, we always see health information management. So I'm putting this slide to help you what's exactly the area of these two fields. With health information technology, more tools are regarding data with computers, hardware, software, networking, programming, coding, data storage, data security that is so important in healthcare. And with health information management, people work on systems, records, coding, but coding in medical information, documentation, administration, and things like that. The area that these two are common is health informatics. So what's the spectrum or continuum of e-health? What's exactly this pointed? It's a really wide spectrum from our genes, macromolecules in our cells, proteins. That is bioinformatics, the genes that have genetic codes on our cells, all of our body cells, till coming to that extreme, public health informatics or population health information. And between these two extremes, we have pathology, imaging, clinical informatics that is regarding one individual health data, health information. So what's the implications of having access to health data? We have workflow. When we have data, we can smooth the workflow of all healthcare operations. We can have the patient care and outcomes, administration, financial processes that is so important in healthcare organization. We have bring innovation to healthcare. We can have providing healthcare services in less cost and less time. And we can provide healthcare for those who are living in long and distance areas, hard to access areas. So it's really important, and it's a leading, promising field in healthcare. Talking about e-health tools, one of the most important things is EMR. We all have this experience going to our family physician, and we are talking to him, telling about him or her, telling about our situation, our complaints, and he or she is just typing in his computer or her computer. So it's not just archiving our information in his or her system. It's doing something on a specific medical software called EMR, Electronic Medical Record, that is doing active interaction with the physician. If the physician want to prescribe a medication that has any side effects for us individually, or any drug-drug interaction, a pop-up comes from that software letting physician to know, you can't prescribe this thing because this patient has this specific condition, or something like that. So with EMR, as we mentioned, it's a software that is in practice in any physicians, and it has full information regarding any individual of that physician, any individual patient of that physician, and it's very confidential file, never ever shared with anyone else out of this practice office. But we have another important tool in the name of EHR. What's EHR? Electronic Health Record. It's something exactly like EMR, but it's something that can be shared through different organizations. And this sharing, information shared, is based on consent of patients before. For example, imagine that you are an emergency department physician, and they bring people bring you a patient in coma state. You don't know what's happened to him. Nobody knows. Was that a hit and run car accident? Was that a head trauma? Was that, you don't know anything about it. But you just have a card of the name of that person. Could be a kind of credit card. You have the name, and you search in a specific system, and you find, there is a system that has all lab test results of Ontario residents, and most of us as patients have consent to our physicians to share that. So physicians look at it and see, this patient, this one has high blood sugar, so it could be a diabetic coma. It's not head trauma. So all processes for doing management of this patient for treatment will change at the moment, at the right time, at the right place, without taking time to do many tests again and again, and taking time to do something wrong with that patient. So it's the importance of that. And in this slide, you can see Clinical Connect, a kind of EHR that is in southwest of Ontario, in previous company that I was working in Waterloo. So as you see, I don't have anything, so there are all allergies, health reports, pathology, new results for lab test result, pharmacy, primary care, radiology. All information from each patient is in this EHR. Another thing that is so important to know in eHealth is that EMR, as I said to you, is connecting to a kind of repository or a kind of cloud-based reservoir that includes all of the latest medical papers, all of the guidelines, all of the medical resources. Thank you. I don't need that anymore. Thank you.
The first one is amazing.
And as I told you, the system has pop-ups. letting physician know that you should do something about this patient. If this medication has side effects or has interaction with other medications. So with using those resources, its name is evidence-based practice, a practice that is based on evidences. And using clinical decision support system, that is actually something integrated in their EMR. It's meaningful usage of EMR. Many physicians have their EMRs, but most of them don't use it CDSS. It's the heart of the system, and really support decision making for physicians. So to help you have better understanding of some other things, some other tools in eHealth, I provided some examples of some of these solutions. One of them is eConsult. When I think the
top one.
Oh, sorry. This one is the logo for eConsult. It's used when the family physician wants to consult with a specialist regarding a specific patient. Is there any real need for referring that patient to specialist, or no, the thing that I am doing with kind of diagnostic procedures or prescription is enough, it's good, there's no need for sending that referral. So it helps to lower the burden of patients waiting for being visited with a specialist that is no need for that, no necessary, visit. With e-referral, here, you see that it's a quite baby step. It's still doing in a specific limited area in Southwest Ontario, and some other parts of Ontario, not everywhere. So if the physician, the family physician and the specialist are using the same EMR with the same company, sending a referral from a family physician to specialist, there is no need for a paper and fax machine. It's just gone in electronically from this EMR in family physician to the EMR in specialist office. And the advantage of having this sent electronically is that e-referral, the small, again, software integrated into EMR, put all together any specific and necessary piece of information in that patient records, documents, that should be seen by a specialist. Sometimes when they do, in current situation, when they send it by paper, there's not all information needed by specialists. E-referral is built based on all guidelines, all things that should be included in that referral. So it's helping better management, better patient care, better outcomes. By virtual visit, and it's the logo for that. When a patient is not sure if there is any necessity to go in person and be visited with his or her family physician, so he can just have a video call with his family physician and talk about his or her problem and see if there is a need to go there or not. Again, it helps to decrease the burden of waiting room in physicians. So it's really helpful. And another tool that is going really advancing each and every day is mHealth, mobile health, represented in M in the small letter and health. It's really a promising area in eHealth. All of us know many apps in our mobiles regarding keeping track of our activities or diet or anything, but it's, as you see in the picture, it's ultrasound. It's inside the physician cell phone, just using a probe. So what's the advantage of having this system being portable, being cheap, being accessible, being, in less time and less cost, provide the same benefit for patients. And just imagine a kind of emergency situation that physician can, just a second, find the problem and do something about it, do emergency surgery for that patient with that. And another area of e-health that is, again, really appreciated is telemedicine. Imagine Northern Territories of Canada, even north of Ontario, there are lots of towns or villages. People are living there, but don't have access to physicians, don't have access. Even if a physician goes there, for example, a surgeon goes there once in a week, and during the surgery, there is a need for a pathologist to do look at the lungs and just give the surgeon, at the time of surgery, is it a benign tumor or is it malignant? You should take off anything, you can put it, leave it. So it's really important that this technology that is providing care from long distance is enabled by e-health. So the pathologist is in Toronto General Hospital, is in downtown Toronto, working in his office, and the patient is in Northern Territories, is in, north of Ontario. And at the time, real time, the diagnosis is being done and the therapeutic procedure is being done, everything is being done. Also, they can use telemedicine for training purposes for the healthcare professionals working there. But public health informatics, it's really interesting just looking at this picture from United States provided by CDC, Center for Disease Control. In 2007, you can see all diabetic patients in adults aged more than 20 years. So imagine that you are a public health manager of the United States. When you see all of your patients, these hotspots are here. You can better manage your resources, your facilities, your human resources, anything about it with just having access to right data. Talking about benefits, it's quite clear. But again, I add this, that this has benefits for healthcare provider, for patients, and also for healthcare organizations. By better patient care, by quality patient care, less medication errors, less medical errors in and providing care in less time and less cost. Another area that is so important in health, e-health, is the importance of privacy and security of health data. Just to mention, in 2013 in the US, 1.8 million medical documents were theft, and expenses average over $18,000 for each patient. So it's
must be fun.
by theft, by it's important.
No, I'm saying it must be Trump.
Blame him for everything.
Yeah. Well, now it's my last slide. It's talking about the challenges. The really two most challenges in e-health. First of all, is awareness among clinical end user, and the other one is interoperability. Something that you IT guys should do something about it. It's connecting these EMRs. There are 14 different EMRs just in Ontario, and these EMRs don't talk to each other. So we have an interoperability issue. And if we solve it, we really have better things. I included some online resources if you are interested to think about it, and if you have any questions.
Thank you so much.